PDE5 inhibitors, we all know are our bread and butter also. But I find they've been mismanaged or misused a lot. Youngsters at the age of 20, 25 take them to impress their girlfriends. Even adults, they take it over the counter without feeling the need of it. Patients who've got psychological issues also take it. So in this next 15 minutes, I'll give you some nuggets of wisdom as to how do we really understand this whole issue. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Dr. Sashank Joshi, I beseech them to bless me always. I have no conflict of interest. I'll be telling you some majestic history of how PDE5 inhibitors really came into practice, how the mechanism is, what are the side effects, and how PDE5 inhibitors are misused, and what's the way out. We all should learn and know, and we do it. First, do no harm, primum non nocere. Any drug we give, we should see that it should harm the patient. This is a beautiful schematic diagram to understand the whole mechanism of erection. The endothelial cell contains endothelial nitric oxide synthetase, which potentiates the chemical signaling molecule nitric oxide to convert guanosine triphosphate into cyclic guanosine monophosphate with the help of an enzyme called guanylate cyclase. Cyclic GMP with various mechanisms allows the whole smooth muscle to be relaxed and the blood enters the penis and remains there. But sadly, cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So what is the majestic history behind PDE5 inhibitors? It was a mystery that acetylcholine can contract all smooth muscles of the body except the smooth muscles with the blood vessels. In 1990, Dr. Fushkot and Zawadzki discovered that the relaxation of the blood vessels by acetylcholine requires the presence of endothelial cells. Acetylcholine acting on the muscarinic receptors of these cells stimulates the release of substances that cause relaxation of the vascular smooth muscles. And Fushkot named these as endothelium-derived relaxing factors, which was proposed again by Fushkot and Ignaro, who got the Nobel Prize independently in 1986 to be called as nitric oxide. Now this nitric oxide is synthesized by oxidation of L-arginine. We need to understand this. L-arginine catalyzed by nitric oxide synthetase, and that utilizes NADPH oxygen as substrate. Now, cyclic nucleotide phosphodiesterase that specifically inactivates the intracellular messengers CAMP and CGMP in a compartmental manner represents an important enzyme class constituted, and there are 11 gene-related families of isoenzyme PD1 to PD11 scattered all over the body. When you look at the history, way back in 1974, Zaprenas was synthesized and later characterized as the first selective PDE5 inhibitor. Zaprenas was shown to enhance nitric oxide-induced relaxation of the isolated corpora cavernosa in animals. And these patients were called for angina and hypertension, not for erectile dysfunction. But they did not improve at all in the hypertension or angina. But they came all the way from long distances for the trials. And one fine day, Ignaro asked these patients that you're not benefited, but why are you coming? They said their life is very good, they're getting good erections. And that's how this drug is now used for erectile dysfunction, not for anything else. So how do we treat erectile dysfunction? We have three modalities: oral drugs, injections of papaverine, vacuum therapy, intraurethral prostaglandin, and then surgery. We have 4 PDE5 inhibitors. They have all sort of side effects of headache, nasal discongestion, visual disturbances, and they are contraindicated with nitrates or any other things. When you look at the complications, most of the patients who take 100 mg of sildenafil, they get greenish blue in halo. Some patients develop increased choroidal thickness, non-arteritic anterior ischemic optic nerve, central serous chorioretinopathy following oral tadalafil intake because they've been given for 6 weeks, 12 weeks, etc. And even some cases of malignant melanoma has been seen. And there are definitely drug interactions. Now let me give you a deeper perspective as to how this is misused. PD5 inhibitors abuse. Abuse of sildenafil was reported since an introduction in 1999 and commonly documented in combination with illicit drugs among men and women of all ages. Increased risk of sexually transmitted disease, including HIV, have been associated with sildenafil use in men who have sex with men. 10 years analysis of adverse event by FDA on phosphodiesterase inhibitors stated that 14,818 adverse effects were reported for sildenafil. There are 1824 reported deaths and reports of cardiovascular adverse effects. Number 2,406. Tadalafil was associated with so many adverse effects and definitely deaths were also reported. Recreational use and misuse of PD5 inhibitors is very, very common. Reports of misuse of sildenafil appear in the medical literature and they have been seen with youngsters, etc., and also patients who've got HIV, etc. Recreational use in young medical students, these are the study done on the medical students. They used to wear condom and related ED seems to be underestimated problem. Frequently they felt it was solved by PD5 inhibitors, so they took it. Recreational use of erectile dysfunction medications this definitely decreases their confidence and ability to gain and hold erection because they feel they are nothing but they have to take a tablet for it. Psychogenic erectile dysfunction actually does not need any PD5 because it is psychogenic. You need to counsel them very well. ED now it's a rising trend in India because India has a rising prevalence of lifestyle diseases such as diabetes, cardiovascular disease, hypertension, and ED definitely remains underdiagnosed. One patient out of 4 of newly diagnosed ED is a young man, and this is a worrisome picture. When you find young students watching porn, they develop erectile dysfunction, delayed arousal. So how do we overcome them? They should not take PD5 inhibitors. In order to overcome their addictions to porn, we need to tell them to porn fast for 90 days. After this period of abstinence, they can start masturbating again, but without porn. This will help you to help them to refamiliarize himself and his own body, his desires, his sexuality. Once he's comfortable that he can achieve and maintain an erection with solo masturbation, you can try sex with a partner. Thyroid dysfunctions, hypo or hyperthyroid, should not be taken PD5 inhibitor, but there are doctors who prescribe that. Because once you make a new thyroid, they become better. Let me give you a new perspective. We are now giving patients daily dose of PD5 inhibitors in most of the diseases like pulmonary hypertension, coronary artery disease, heart failure, in altitude sickness, Raynaud, LUTS, breast cancer, etc. Because chronic daily tadalafil prevents the corporal fibrosis and veno-occlusive dysfunction that occurs after cavernous and nerve disease. And a beautiful study says that PD5 inhibitors are therapeutics, heart disease, diabetes, and cancer. My last part of talk is the ethical perspective. What we should think, how should we think, and where should we think? Now, we know about that the two things which are very important are nitric oxide and PDE5 inhibitors. These are the two things which we have studied. So what does nitric oxide do? The science behind nitric oxide is that it increases the blood flow, increases the tissue delivery of oxygen, increases body get risk of toxin, reduces the blood pressure, risk of cardiac event, and asthma attacks. It's a wonderful molecule, it's a miracle molecule, has multiple. But nitric oxide also reduces as we age. At the age of 60, you will have only 15% nitric oxide. So you need to supplement something which can increase nitric oxide in the patient. So the bottom line of normal sexual function, if there is no nitric oxide, you cannot. So where do we get the nitric oxide from? Nitric oxide, we get it on stimulation. Nitric oxide is formed by the enzymes of the endothelium which convert L-arginine into nitric oxide. So we need to see that as we are scientific people, L-arginine is equally important in maintaining or giving a patient an erection. So enough studies have been proven that L-arginine in men with organic erectile dysfunction also produces good erections. PD5 inhibitors do not increase the nitric oxide level, but they potentiate the nitric oxide effect to stimulate. They need to be aroused. There are 40 to 50% patients who are not responding to PD5. Out of the rest, 50% gave up PDE5 inhibitors within a year of treatment and rest within a couple of years. Why is it so? Because we know PDE5 inhibitors need to, patients who we give PDE5 inhibitors need to be counseled as to how to be taken. They take it, in the highest dose, or they take it just after the heavy stomach. They just take it below the before the sexual activity, and they use it without sexual stimulation. So today, the world of Viagra is 50% of men prescribed Viagra did not reorder. These are vasodilators and not relationships. They are not aphrodisiacs. So after so many years of treating erectile dysfunction with various therapies, we have not been able to reverse the pathophysiology of erections. So the point to ponder is ED a symptom or a disease? If it is a symptom, we need to give a drug, a pharmacotherapy, which can give him an erection. But if we consider it to be a disease, we need to have a permanent modification to the natural course of the disease, and regenerative medicine of phytonutraceuticals is the answer. Because the risk of all risk factors giving rise to erectile dysfunction is endothelial dysfunction. We need to focus on endothelial dysfunction. We have a lot of strategies which my teacher, late Dr. R.D. Lillis, published long time back. We have several strategies to improve the endothelial dysfunction and give patients a better results. So my take-home message is that men presenting with symptoms of ED should undergo a thorough medical, sexual, psychological history of physical and selective laboratory testing. For men with ED, validated questionnaires are available. Men should counsel that ED is a risk marker of underlying cardiovascular disease. Men with ED should be informed regarding the treatment options. When men are prescribed oral PDE5 inhibitor for treatment of ED, instructions should be provided with maximum. For men who are prescribed PDE, the dose should be titrated to provide optimal efficiency. With 17 years of clinical experience with PDE5 inhibitors, which you all have, we have found that they are not the cutting-edge pharmaceutical solutions. Furthermore, how much we give up to a little more is more important. We live in an era of multiple drug choices, and so all PDE5 inhibitors are highly effective and safe treatment, yes, but yet successful ED treatment goes beyond us prescriptions. So what do we have? What are the emerging tools we have for treatment? We definitely have regenerative therapy, and what is more important today, before regenerative therapy comes into proper practice, we know that there are a lot of risk factors which are all modifiable risk factors, like dietary, sedentary lifestyle, dietary, smoking, etc. So lifestyle modification, you may be Hindu, Muslim, Sikh, whatever, but make lifestyle as your first religion. A beautiful study, original study by this Cleveland Clinic said that nutritional intervention in their study not only halted but even reversed the coronary arteries. Look at a huge plaque which was just opened up by nutritional intervention, no medications. And even 2 times Nobel Prize winner Dr. Linus Pauling said nearly all diseases can be traced to a nutritional deficiency. So what are we waiting for? We need to give our patients the best advice on nutrition, and nutritional intervention can work wonders. Because lifestyle, dietary recommendation for erectile dysfunction and female sexual dysfunction has proven to reduce the pro-inflammatory milieu, insulin resistance, reduce the oxidative stress, also improve endothelial dysfunction, and improve well-being with reduced burden of sexual dysfunction. So if you have patients of erectile dysfunction, try and at least give them nutritional advice. Try and give a U-turn to their metabolic imbalance. Don't send them to quacks or anything. They will go themselves, but don't advise them. Ask them all the questions, etc. Counsel them. Otherwise, send them to a good sexologist. He will see that he gets a good erections. This is my book, Sex Has No Expiry Date. My last slide. All metabolic inflexibility needs to be fixed. PDE5 inhibitors are misused globally. They do not increase the desire. They do not improve the endothelial dysfunction or cure erectile dysfunctions. PDE5 inhibitors have side effects, adverse effects, and have dependency. PDE5 inhibitors should be avoided in young adults, though they are erectogenic drugs but have been a mismanaged weapon. My serious plea to all is, ask your patients for AD. It's a harbinger of death. PDE5 inhibitors are not a panacea. We are aware of its impact. We have the wisdom. We have the tools. We must act now. Thank you all for your love.
So thank you, Dr. Jumani, for your fantastic presentation. It was mind-blowing in many ways. The slides were fantastic, and the way of delivery was also fantastic. And more interesting was you are still having some time, so you finished in time. That is the best thing because we are already running late. So I can accept 2 questions from the audience.
You will be curious. Like lifestyle disease, you got a lifestyle track. You mentioned about the deleterious side effects. What are the side effects? The problem in India is that though we have landed in more, healthcare is still in the very, in fact, we rarely report side effects. So in your experience, tell us what are the rare side effects you had experienced, you had reported, so that what precautions, as the urologist, that none of us can report
side effects of PD5 inhibitors.
Rare side effects. You said about side effects, everybody know. From your experience, there are some are very deleterious.
Most of these patients get headache, they get dizziness, they get gastric symptoms like nausea, vomiting. Many patients on PD5 inhibitors get headaches. Some patients who take higher doses of sildenafil, like 100 mg, they develop greenish, they see greenish bluish halo in the retina. And some patients do not tolerate, they feel the BP is getting low, and, so they just don't want it.
There are rare side effects about the optic neuropathy. Have you encountered this? What is that? What is that? Deafness. These are all the things you should have.
These are the common side effects which we see. And these are sometimes some patients really unbearable because they feel that they would become blind, or they would become deaf, or they would be vomiting, and they will have severe backache.
Or what is the worst side effect you had encountered? Maybe
severe backache and greenish bluish halos. Patients started seeing everything green, blue.
The brand, again you said mismanaged, but in India healthcare is totally unregulated. There are, see, the erectile pricing. The origin, if you go to Nara, he will say that, if sir, Pfizer drug, what is your best brand? Would you advise? Because so many brands are available.
I prefer low dose of tadalafil, 2.5 to 5 mg.
There is no brand you
brand, why should I tell you?
You talk for the see, this is here where we differ, okay?
So, 1 minute, sir.
See, the original brand
I can tell you in person,
to call yourself
I can tell you in person.
What this is what you this is very limited thing. So that is why the quality matters.
Mild pill.
Thank you, sir.
So the interesting things are that what we rarely encountered, but something of real concern are coming. There is some link with cancer has been found with use of all these drugs, like melanoma.
Yes.
So there is stimulation of mitogen-associated protein kinase,
Absolutely.
and that might lead to melanoma, though the association is not very clear. Actually, there are some contrasting documents. One type of documents, they are suggesting that they are actually promoting apoptosis of the cancer cells, so that might be beneficial in certain types of cancer. On the other hand, it has been found to be associated with development of certain cancers like melanoma. So the exact result yet to be known. So I thank all for the fantastic session again.
Yeah.
If I may ask a small question
This
and
is the
comment.
only paper we have.
Yeah. Excellent lecture, Dr. Deepak Jumani, as always.
Thank you, sir. Bless me.
Now, you mentioned about the role of nutraceutical. In the morning when I was having breakfast, I noticed and I asked the gentleman, why you are serving repeatedly pineapple and watermelon in the fruits, And they said there are special instructions from Dr. Natesh Prabhu that these 2 fruits must be included.
Absolutely.
So then I was wondering, what is so special about it? And the watermelon, as you know, has citrulline, a lot of it, and it converts into L-arginine.
Absolutely.
So I want to support what you said, that you must be sure about all these amino acids. And then pineapple has bromelain, which increases the testosterone levels,
Absolutely.
So the only thing is that
Urad dal is very good. It increases your
the only thing is it is being served 3 times a day, in the breakfast, lunch and dinner. So the significance and the timings you mentioned.
These are all really good when it is in the plate. When it comes in the form of tablet, it's very, that is why sometimes we argue. The supplement costs more expensive. That is why is it the pricing and the brand, which side for obvious reason you are not going to discuss. That's why you are not expecting.
I want to highlight, that it is very simple these days to search the Google, which are the amino acids, which are the fatty acids, which are the minerals and vitamins good for the sexual health, make a list, and what are the natural sources, So at least in the lifestyle modification, I couldn't agree more than what you said, that they have seen half an hour to 45 minutes of walking every day and losing weight, quitting smoking, and treating all the preventable causes of coronary artery disease. The risk factors are the same, So the diet has a great role, and it should be used by every doctor. Thank you.
And candlelight dinner.
I will-
mentioned about the candlelight
I
dinner.
request the chairperson to complete the speaker.
Next.
Sir, please proceed, chairperson.